Happy Thursday, Facebook friends. Welcome back to this Thursday's edition of Teacher Talk on Facebook. I'm Angie Garza, Director of Professional Learning and Educational Services at ROE 47, serving Lee, Ogle, and Whiteside counties. We are so happy to be back with you here again on Facebook on this first Thursday in December. So welcome to December and welcome to our impending holiday season. Today's Teacher Talk is really in the spirit of the holiday season, because we know that the holidays are not always the easiest for everyone, and we're seeing actually some data and through some of our experiences with some of our community members, really realizing and acknowledging that we have some social emotional concerns, some mental health concerns in our area that we want to be able to respond to. So we are going to be talking about all things youth mental health first aid this morning. And to have these very enlightening conversations, I am joined by my friend, colleague, and co-host, Ms. Stacy Dingus, our digital teaching and learning specialist. Good morning, Stacy.
Good morning, Angie. Happy Thursday. Happy first week in December. No snow on the ground yet, knock on wood, right? So that's a positive. Excited about the conversation today, a serious topic, but something that definitely we can't talk enough about. Youth mental health is something that we all should know, we all should be aware of. And I'm excited to kind of share our part at the ROE to share out about what we're doing to address this very important topic. So looking forward to a good conversation this morning.
Stacy, I am as well. And you're right. There's a certain level of gravity to these conversations, but I'm reminded that several years ago, there was just a stigma about even talking about mental health. And I'm very happy to see that we're opening the doors to those conversations, and we're thinking more strategically as a school community and as a community at large about how we can provide supports to not only our students, but some of other youth in the community around having a positive state of mind and mental health. So, you know, we have some experts in our office who support our families and do great work and are actually trained in youth mental health. So to have our conversations this morning, we are so pleased to welcome to our Teacher Talk our Nexus Program Coordinator, among other things, Miss Diana Meridian. Good morning, Diana.
Good morning, Angie. Thanks for having me.
Thanks so much for being here. We like to joke around the office that you are kind of like one of our ad hoc co-hosts because of the number of hats you wear and how many times you've been with us on Teacher Talk. Always great things to share. So we're so happy to have you here this morning. We are also welcoming to our Teacher Talk for, I think this is visit number 2, one of our Nexus family support specialists and youth mental health first aid trainer, Michelle Elmendorf. Welcome, Michelle.
Good morning. Thanks so much for having me.
Well, we are happy to have you and happy and excited to have you share about all of the great things that we're supporting our communities with. So let's get started. You know, I mentioned youth mental health first aid training. So Diana, can you tell us a little bit about what that training is? What is it all about? How is it delivered? It's one of these great resources and tools that I'm not sure our community knows a lot about.
It is a training for any adult, really, that is working with youth to assess for a mental health challenge and assess for the risk of suicide, and kind of real, very common steps that you can take to help that youth in that situation, and also then how to help yourself after having those conversations, after dealing with that. It's a great program. I've even used it real world in situations with youth that I've been working with. So it's very easy, and you can start using it right after the training. It comes to us from Australia, which Algie is my little mascot. And we are offering it virtually, but you can do it hybrid, virtual and in person, or just in person. It runs about 6.5 hours. There is some pre-work. Some of the schedules can be a little different, but we're pretty flexible with kind of service delivery.
Diana, Angie had mentioned earlier that, this topic of youth mental health kind of was almost taboo even a few years ago. And it's something that we definitely are hearing more about. And we know in the education world that it is something that is constantly being talked about in our schools. Can you talk a little bit about why this training is so important?
Yeah, so there's a lot of focus with social emotional health and just overall mental health out there. But this is evidence-based. This is work that has been going on for a few decades now. And there is also an adult training that you can do for people that are working with adults. There's also training for people in law enforcement, same kind of training, but just kind of tailored towards them. And this is kind of just more of the focus on youth. There is also a training that like school districts could do where it's kind of peer-to-peer, where it's teen mental health first aid, where it's other teens that are trained to assess the risk of a mental health challenge and kind of notice those cues and notice those behaviors and then what to do and where to go. And so it's kind of very concise and just kind of all in one nice package. And so it's been very good to bring to our area. I know that there are other programs that are also doing the training. It's not just an ROE thing. So we just want to make sure that we're able to get it out to as many people as possible.
Michelle, you do a lot of work in our communities, in our schools, with families, with students, with teachers. We talked earlier about the fact that the conversation around mental health and social emotional well-being is growing. And especially as a result of our COVID-19 pandemic, we're seeing lots of new needs and concerns emerge. So can you talk to us just a little bit about what you're seeing in your work out in the field? What kinds of things are our youth and our families facing in terms of mental health and social emotional wellness?
Well, unfortunately, many of the students, the teachers, the families, many of those people have been heavily impacted, unfortunately, by COVID. It's imperative that we are able to support our youth and our teens. But at this point, it's also imperative, I think, that we are able to support each other. So not only does mental health first aid benefit, the students that we're working with and the teens that we're raising, but the teachers, the school staff, the coaches, the parents, any really adult or anyone who works with students, we all benefit from having the ability to, pick out the signs and symptoms and being able to connect, a kid or someone, a peer, to services to help with their own mental health, even while we're dealing with our own in some instances.
Diana, like Michelle just said, it's definitely out there and it's important that everyone is aware of this. So can you talk a little bit about the programming that the ROE is doing, what services are offered, the trainings that are there, how the ROE is kind of helping to address this situation in our schools and our communities? Yeah,
so we, as part of our Nexus program, one of the other hats that I wear, we are offering this training to our school districts to try and get staff trained. That's not only teachers, that's paraprofessionals, custodians, counselors, nurses, whoever. And so we're trying to get as many people as we can trained, trying to kind of work within the school districts with their schedule, or what works for them. But then also working on, helping those school districts with social emotional supports, infant and early childhood mental health consultation, just kind of this really kind of overall support as that regional hub to bring that together to our area, and trying to kind of just give the access where it needs to go, and just make sure that we're kind of breaking down those barriers for school districts, for staff, so that they can actually get this information. I would hate that somebody wasn't prepared because they didn't have access to this kind of training, because it's not going to help anybody if we don't get them trained, and if they don't have those tools. So we just really want to get the information out there. It's not like it's this, hot party that we're trying to keep people away from. We want them to, come in and be a part of it.
Diana, I have to tell you, I think that's the first time I've ever heard of hot party. If we're having hot parties at the office, I wasn't, I don't think I was aware of that. So thanks for all of that great information. We have an incredible group of people who are working to support our students and family at the office, and we're so proud of those services. So that being said, Michelle, tell us more about Youth Mental Health First Aid Training. When's the next training? How do I sign up? How do I plug into this, as Diana calls it, hot party?
We are having the next training via Zoom on Thursday, December 9th. So next week on Thursday, December 9th, we would love to see your faces, as many faces as we can get via Zoom to talk about mental health first aid with us. That training is from 8:30 to 2:30, and again, all via Zoom. So you can do it in the comfort of your own home, from your office, wherever you want to be. If you want to register, that is fantastic. Just go onto the ROE 47 website, and it'll give you a link to register right there, and we'll see you on Thursday the 9th.
So Michelle, just to clarify, even if I'm not a teacher, if I'm not a paraprofessional, if I'm just a community layperson who does a lot of work with young people, can I sign up to participate in this training?
Absolutely. We would be happy to have anyone and everyone who wants to learn about mental health first aid.
That is great news. Well, friends, there are a few things that I kind of was able to tease out of our conversations and really resounded with me as we look to close our teacher talk for this Thursday. I started our teacher talk this morning by kind of talking about the holiday season, and usually historically that's when we see a great deal of concerns and conversations come up about mental health and getting through the holidays for some of people. But really, this is an important conversation that spans an entire year and an entire lifetime. Michelle mentioned symptoms. We have been so tuned in on recognizing signs and symptoms that are physical in nature from our COVID-19 pandemic. This is a powerful reminder that we also need to be well in tune with those signs and symptoms of mental health, and having a positive social, emotional well-being. So this training that's being offered is a wonderful opportunity for us to raise our awareness and put some more tools in our toolkit to help people who might be struggling, not only during this holiday season, but throughout the year. So we would encourage you to please sign up to attend and participate in our Youth Mental Health First Aid Training coming up very soon. This wraps up our teacher talk for this Thursday. We want to thank our friends and our colleagues, Ms. Michelle Elmendorf and Diana Meridian, for joining us this morning to share this very important information. We want to welcome you to the month of December, and Stacy and I would also like to encourage you to have an amazing rest of your Thursday, an even better weekend, and we will see you right back here next Thursday for another edition of Teacher Talk.